But once I, became an interlocutor and I started interacting with my candidates, that's what you are, you're called actually, you're called as a candidate. So when you come in, there's certain things that was actually hurting me. In fact, that's what I felt, because you are all such a wonderful professionals, but coming in front of the interlocutor, almost 80% of the candidates were scared. That was the first thing that I realized.
Good evening, Father and my dear friends.
Good
As
evening,
you all
Edu.
know, we have a special session today. I'm very pleased to introduce her. She has completed her School of Media and Communication and she is working as an assistant professor at DePaul Institute of Science and Technology, and she is from Ankamali. Her name is Maria Paul. On behalf of EduSkills and Father Saleen Joseph and all those who are gathered here, along with the admin panel, Maria, I welcome you to this session.
So very good evening, each and every one of you. As Rajani said, or in the Zoom meeting, that message, there was something called Interlocutor from 2019. It's just, recently I have been thinking about being an interlocutor. And then I realized, oh, it's been so many years now. I mean, it's 2 years, more than 2 years now, being an interlocutor. But initially, I just happened to be an interlocutor by chance. And now I realized there was something much beyond that when I actually came into OET, because I never thought I will be an OET interlocutor, or I never thought I will be something like that. But it's just I saw this opportunity. I just thought I'll apply. And that's how I came into it, just to let you know how I actually became an interlocutor. But once I, became an interlocutor and I started interacting with my candidates, that's what you are, you're called actually, you're called as a candidate. So when you come in, there's certain things that was actually hurting me. In fact, that's what I felt, because you are all such a wonderful professionals, but coming in front of the interlocutor, almost 80% of the candidates were scared. That was the first thing that I realized. And it was actually heartening for me, because as far as I understand, you are the people who interact with strangers the most. Right, you are the people who interact with strangers the most, because most of your patients are strangers to you, and you have this lovely smile that you welcome them with. And everybody, I ask this question, why did you decide to become a nurse? One thing I ask that question is, I think I hope everybody knows the verbatim that is being asked during the session, the speaking session. There is a verbatim that is exactly what is being asked. There is nothing else that will be asked except for your task. The rest of them is actually the verbatim. That is exactly, we have to go by the verbatim. So in that, there is an interactive session in between, just to accommodate ourselves with the voices. I hope you remember. Most of you have gone through it, I suppose. So at least you have seen the verbatim, definitely, I suppose. So during that time, there was few questions just to for an interaction we asked. So most of the time, my staple question is, why did you decide to become a nurse? That's what I ask. And many of the times I get this answer. In my childhood, I was sick. I went to the hospital and I saw this a nurse. She was in white dress and she was very caring. She gave me an injection and I didn't have any pain. That was so wonderful. I also thought I need to be. Most of the time you get something like this, something related to childhood, interaction with nurses, most of the time. But then, in fact, many of the, I asked them, how long have you been working? I do interact even before the session begins, speaking session begins. Okay, I do interact. So I asked them, I just talked to them just like that to know how well your English is. And the thing is, I understand most of them have got good English, enough for the test. Okay, I mean, enough for the test. And then because it's after some time I told you, I realized everybody is scared. And even if you have such a good English, you don't speak it out during the task. You have a good English with you, you have a good language with you, but you don't speak it out during the session. It's like as if somebody has put a gun on your forehead or somewhere down here, and you're being, you're doing something. That's the feeling we get sometimes. I get sometimes being an interlocutor. So after that only I started to make them talk. I do my verifications before, and I ask them for the passport, then I ask them where you are going. I ask you all, where are you planning to go? Why are you going there? Just like that I talk, and then I ask them, where were you working? How long have you been working? Just like that, so that I know how far they can go. I know, because accordingly, I can also talk to them. I mean, from my part, I can be more accommodative to them. But don't expect every interlocutor to be so, because my own colleagues, some of them I know they're very fast, because as long as the candidate comes in, I don't know whether they interact, they just go by the verbatim, 20 minutes, done, definite, 19, 50, like it doesn't, for one or two of them, it doesn't even cross 20 minutes. They finish fully beforehand. For me, sometimes it goes 20, 21, it goes, sometimes it even goes 21 beyond that. I'm like, oh my God, please stop. And I show them, done, very good. I stop like this and I signal them sometimes. Okay, that's me. Okay. So each interlocutor is different different. They are all individuals, but we will all be doing the same task as a speaking, for the speaking session. The thing is always the same. That is basically it's the verbatim, no matter what. There is nothing extra with that. And we only give you 5 minutes. Sometimes I go a little beyond 5 minutes because I just thought, okay, let you be happy and stop it. So I just, okay, fine. And then I say thank you. When I say thank you, most of the candidates try to stop for some reason, by God's grace, definitely. So that is one thing. The main thing is you're being scared in spite of the language. And one thing that changed my thought process was one day she was a fresher. This candidate came. She's very interested. She's very good language, really good with it, very good English. Okay, she just graduated. She was a fresher, as I told you. But you know what? The moment the speaking session started, and I interacted. So what I do is when my candidates come in, we just talk. We just have a casual talk. We just talk just like that. I give them a smile, so that I just ask them to, we are asked to make you calm and comfortable. Okay. And me being, I teach communication, actually. That was my subject also, communication and journalism. So communicating is very important, as far as, when our interviewing techniques are concerned. So you have to make the, interviewee comfortable. We learn that, actually. So with that principle, I actually try to make the candidates comfortable. Okay. So after, making this candidate, also this girl also comfortable, that's only after I started the conversation. Once the conversation is started, once the speaking test starts, we can't pause the recorder. It is 20 minutes on the go. There is no stopping in between. You know what? The moment the session started, the whole person changed. She was very interactive. I knew she was scared. She was very scared, but I only have very few minutes. Okay. Understand, we only have 30 minutes for a candidate. Okay. And in that 20 minutes is the test time. And the 10 minutes is the warming up and etc. rounding up session. So it's basically only 30 minutes for an interlocutor with a candidate. Okay. So in the 5 minutes, that in between that 10 minutes, because somehow it will go to 21 minutes and all. So I somehow try in 7 minutes, I try to wrap up that warm up session. So I had enough, I talked to her enough, and then said, don't be scared. I asked her if she wants water, everything. I made her comfortable, and then only we started the session. But what happened is, the moment the session started, she was so stringent. She was as if she was giving out a speech. Literally, I remembered my childhood wherein I went in for a speech and I couldn't speak. You are all very natural just before out of the stage. On the stage, you become so stringent. I know you become so rigid. Exactly. I knew this was not going to get anywhere, but I was very helpless because I can't do anything. Because you asked, why did you decide to become a nurse? I asked like this. She said, I decided to become a nurse. She goes like this, exactly like you are giving a speech. I decided to become a nurse. This is all what you have to talk about. But she goes, I decided to become a nurse because there was an act, a kind of something she was trying to put in. I don't know what it was, that scare or anything. Anyway, the language all was good. I don't know. We never get to know the score. Okay, so don't worry. The first thing about the interlocutor is the interlocutor never gets to know about the scores or nothing. We only do our job. The rest of the thing, as far as I understand, happens in Australia. Okay, that is where all your tests are graded. Okay, so I tell my candidates, don't worry. However you speak, I am not going to value your speaking test. So don't worry at all. What I am going to think about you talking. Don't have that feeling. What is the interlocutor? Don't worry. We are not there for that. We are only there to help you actually. So just talk naturally. Another thing that has been told in the verbatim is just talk naturally. You're not here to give what is the your practical knowledge or your knowledge about nursing. Nothing like that. It's all about you being interactive with the patient. That's what they're not going to look how well you know the subject. It's how well you communicate basically. But just when you say you communicate, I want to very much stress on one thing. When you communicate naturally and properly, because one of my colleagues as an interlocutor in a task there was something about holding your breath for 3 seconds. I don't remember what the case was. It's more than a year ago. So the thing was basically you have to hold your breath 3 seconds and whatever it was, it will be all right. I don't remember what it was. Okay. So this person was very tensed and she said, hold your breath for 3 minutes and everything will be okay. Is there a problem with that? Hold your breath for 3 minutes and everything will be okay. Is that a problem?
Yes.
Of course,
yes,
there
of
is.
course.
Okay. Of course. Okay. So that is not a professional. That's a general knowledge, a common sense. So just that knowledge as it is. Okay. And she said she didn't say anything because this girl is already tensed. So she just let it go. So she didn't. And after the session, she told, why did you say to hold your breath 3 minutes? And the candidates asked her itself, did I say 3 minutes? Okay, did I say 3 minutes? That means the candidate was also not aware she was saying 3 minutes. The basic factor was fear. Okay, so my dear candidates, the basic thing, the very first thing I want to tell you is don't be fearful. Okay, don't worry, don't be scared. Okay, sometimes I tell them, you just think one of those emergency cases that you have been doing in the emergency room or casualty, or somewhere you have done so many cases. So just take one of those incidents. Think you are here. Think I am that emergency person. See, the very basic thing is you are all handled emergencies. You have all handled emergencies. Many of them come from emergency department itself, MICU, etc. ICU. Many of you work down there. There may be some cases where they're not in emergencies. Very few. I don't know why, but most of the times I get people who are from emergencies, and I'm very happy about that because it's easy to tell them. So the very first thing is, when you have an emergency, you have no time to prepare. You have no time, 0 seconds, basically, 0. Okay, but you do it. You see, you give CPR or you give, is it IV that you have to give, or it's whatever it is, you just start it over. You have to put a ventilator, whatever it is, you suddenly start doing it, right? You do that emergency, you do it. Okay, everybody has this incident. As a nurse, everybody will have this incident. Okay, just understand, my dears, you are in an emergency, which is only for 5 minutes, just 5 minutes. Okay, during those emergencies where you were in, you didn't know what was actually the problem. You didn't know what exactly you have to, but you did it. You have been trying to find out. Maybe it took hours, days sometimes, but you did it. Here, you're exactly given what are the things that you have to do during that emergency. The tasks are already given to you. for a 5-minute emergency. Okay, just 5 minutes. Okay, 5 minutes emergency, and what has to be done is already given to you. There, you have no time to prepare. You don't know what the problem is, but you try all your level best to do it out. Here you have it, everything right, very clear in front of you. And the next bonus is, there you had no time. Here you have 3 minutes to prepare. 3 minutes for a 5 minutes emergency. Okay, you did bigger emergencies with no time. So won't you be able to do a smaller emergency with this time? With very, very clear emergency. Exactly, you know what needs to be done. Okay, so that's all. Nobody here is looking out for high funda languages, big literatures. No, nothing. Okay, as far as you know to speak with a smile, with some love in your heart, with a caring position, things are fine. Sometimes I ask, some candidates, I would ask, maybe some task that is with respect to the task. I mean, I might be asked to do so, okay? So sometimes some people are not very clear on giving this consideration. So maybe if it's, maybe I have my fractured hand and I want to have a bath. Sometimes I ask, no, I can't. No, I want to bath. I don't know about my hand. It's okay. I have to take the bath. Then, ma'am, in this case, we can't help it. This is what the doctor has said. Sometimes people go like that. Okay, but then I just sometimes some candidates is, oh, ma'am, I understand your, this. It's very irritating. I understand your situation. If it was me, I would also have felt the same. But please understand. See, if you wet your hand, I know it's going to be, sometimes water might enter and infection might happen. So that will be much more problem. And the doctor has very specifically told not to wet your hand, but I can still give you a suggestion. Maybe wear a plastic bag or something and, tie it up here and you can have a bath. Just bring an option. Sorry about my own. That's how we do with our parents at home as well, right? If it's my sister, if it's my mother, if it's my brother, if whoever it is, somebody has a hand and wants to take bath, you being a nurse at home, we do something. To be very frank, my mom is a nurse. Okay, so I know it. So how my mom manages. Okay, so that's it. So just be there. And so now I ask, these are, coming years of coming together and thoughts. I believe Holy Spirit has given me, because sometimes I ask my Lord, I don't know, Lord, how to do this, because these people coming in, they're very scared, and I try my level, but nothing is happening. Okay, so it was some thought that came in gradually, and it just appeared to be like this. And I myself sometimes wonder, oh, that's a very good thought. And sometimes candidates who come in also, I tell them, you have been with strangers, so many strangers, right? So today the stranger is me. Don't you think you can treat me as a stranger, and they will be very happy to? Usually they are very happy. And I've been for the test, the last OET test I was there. And so yeah, they were all very happy. Okay, so this is how an interlocutor, this is me being an interlocutor. I told you each interlocutor is different. So whatever, some people are very serious. Sometimes my own colleagues, they don't even properly smile at us souls. I know interlocutors, my own, they talk, definitely they talk. But they are people, they don't have a smile. So some of them don't even have a smile. It doesn't mean everybody should be smiling. Everybody would be very happy. Everybody would be welcoming. There is nothing like that. Okay, it's just understand you had different persons, very big, total strangers who were very arrogant, who were rude. All those patients you have been through, right? All those patients you have handled. Not everybody was very loving and it's okay, it's nice. No. Some of them were very arrogant. Still you managed. So don't you think you can manage the interlocutor also? Right? And one thing is, before being an OET interlocutor, okay, I've heard about OETs. My husband's cousin's wife was actually going to write this OET. She went for an OET training and she came and told me, I don't know what this OET, okay? OET is, I have only written my IELTS. I have written IELTS in back in 2005. That's all what I know about IELTS. Okay. So she told me, oh, it is, Chichi, it is very hard. I asked, what is the problem? She said, they have a problem. They keep on asking you something. They say no, then we can't say anything. You suppose if you have a fever and I ask you, do you have pain? You say no. Then I ask, whatever they think, they don't have they are not sick, but whatever they think, they will just say, we can't give a solution. Then I thought, yes, this is really bad. It's very bad, because if I am sick and I think I have my own thought process, and whatever the candidate asks me and I keep saying something else, things are not going to work out. Because each person can keep on saying whatever and there is not going to be any end to that problem. Okay, so only after I went in for this OET, I realized there is nothing like that. We are given clear instructions. The interlocutor is given clear instructions, like this is what is. Maybe I told you about the bandage. So there is the person, the patient is there with a broken arm. Okay, already bandaged, or coming for a, what do you call, a second session, or visit to the doctor after a week or something or so. So the problems regarding that. So I might be clearly told, you tell the nurse you want to have a bath. It will be clearly said that. It will be clearly pointed out in my task list. In my task, I have a task list. Okay, and then the next will be eventually agree to the nurse's suggestion to take bath, or whatever it is, whatever it might be. Okay, sometimes you will have to take a consent for an injection, might. Okay, or an endoscopy. Recently, the last week, endoscopy, there is a suggestion, consent had to be taken for endoscopy, and I am given the instruction, you're very scared, I want to postpone the endoscopy. Because my mom had done endoscopy years ago. The task is given to me. That is my problem. I have been told that. So you are scared. Tell the nurse you are scared. You're scared. My mom had a problem long years ago. She had done this, and she couldn't eat. So I am also scared. I don't want to do it right now. Now there is not much big problem. So I'll just postpone it and I'll do it later. A few candidates were very, very nice. I really liked them. They said, you know what, right now the problem is a minute problem. If you do the endoscopy right now, we can find it at the root itself, and so that we can cure it. If you postpone it, this might grow worse, and it might be very hard at a later point of time. Okay, now they said it very nicely, very well. Okay, so we feel very good. Okay, fine. Yes, and you don't be worried. See that we have handled so many cases, and things are all fine. We are there with you. Don't worry. The technology has also advanced, and there is you don't even know what is actually. Just go on like that. You will also be given instructions. Certain instructions you will also be given down there. Okay, just try to read it together. Into a situation and just communicate. That's all what is required for the speaking test. They're looking how well you can talk to the a patient, or sometimes it might be the relative of a patient. Sometimes you have the mother of a child. Sometimes I become the mother. Sometimes I become the old woman. Sometimes I become the niece. Let's go on. Sometimes I become an aunt, because sometimes it might be a relative of the patient. Sometimes you yourself become the patient. Okay. So that is very basically about the speaking test. I don't know what is the time actually. I mean, if half an hour is over, I don't know. I think I have given you a basic about being there at the speaking test. I hope so. And there is nothing to worry about, very basic. Okay, and the interlocutor is not there to assess you, only there to help you. And if just see, you are people who can read faces, who can read people well. Okay, so as long as you enter the room, you can well diagnose an interlocutor, how that person is. Most of them are pleasant. Okay? Most of them are pleasant. We are asked to be pleasant. Then one thing is, when we talk, sometimes we have we might stop, right? Sometimes we will have to think. that is allowed. Sometimes, a small pause might happen, maybe 3 seconds or 10 seconds, a small pause, a pause, we might pause. Okay, suddenly you don't know what exactly to say. We are just okay, maybe we go like this. That's okay. You can go on, just go on, because that is natural. It can come in when we interact naturally. Such things can come in, that small gap. Don't think there is no go there. You can't stop. You just have to keep on talking. No, nothing like that. Just be calm. Just be calm and talk. Okay. Hope you're all getting me, and that is basically what I want to tell you. And yeah, do your part. The rest, God will take care. Just don't be fearful. That's a very basic thing. Just be calm and think of one of those emergencies you have been, and one of those patients you have been treating. Maybe take one rude patient also whom you were really finding hard to take care of, or you're finding difficult to handle. That's it. You have a very nice interlocutor down there. Handle very nicely. That's all. Okay, and don't think the interlocutor himself or herself is telling, no, I don't want that. It is because there is instructions, and they can't go away from the instructions. Okay, so if there is a consent, understand you have to convince that person, that patient down there, to take the consent. Usually it is like that. Okay, I will be given your card and my card also. Okay, after one time I go through the role play, then I know what I have to do. So most of the time, then I keep reading what is exactly given on your role play, and I see you will be given, the various remedies, what can be given. They'll just put it in the bracket. It is you who actually translate it. See, sometimes about taking food, it's during my initial level. So they said, I don't remember, you can have some after some operation, I think, or it was after some operation, you can give some soft food, then the candidate told me, it takes some juice first, and then slowly move on to solid food, like that she told. Okay, first I thought, okay, it is all there, down there somewhere it is written. Then I realized it's nothing like that. Soft food is written down there, then they convert to solid food. She is the one who told that you can take watermelon juice, you can take apple juice, any juices will do. Take something very soft, or you can make some oatmeal slowly. And she is the one who gave this suggestion. This is from her thought process that came on. Okay, so certain things, it has to come to our brains. Okay, you ask a soft food, maybe have some juices. Okay, just like that, or some porridge. Okay, so that just have to come to our mind, soft food. Okay, and then there are things that you have taught me. This is things that you have taught me. This is how you go about. Like, these are things my candidates have taught. Okay, so these are very basic things. And one thing I understand, it's very basic thing, and it is basically how you translate it to the patient in simple ways, rather than telling. You can initially, there are people who have said that also. Okay, you can have soft food, you can later on have solid food. I'm like, okay, yes. One thing is, I don't too much ask questions. I see what the candidate is almost like, and then I ask the questions. And in the sense, somehow I just think let them get the enough score, so don't not to confuse. And because some people don't really get the language too much. That's what I told you. Initial level, when they come in, I just have a talk and understand how far they get, because it has happened to me. Certain questions, when I asked, the candidate didn't really get it, and I felt bad. So I changed the question. I did actually put it as a connotation. I don't remember, but she didn't understand. She asked me, I'm sorry. Then I said it to second time. Then she didn't again get it. Then I understood. Then I changed the question completely in a different manner. I changed the words. I knew. So certain people, you can't use the connotations. That's what I told you. It doesn't mean it doesn't happen. You have to have big knowledge or too much of idea. It's basically of comprehending, what the patient needs. That's it basically. And from my part, I try to do this. Okay, I think most of the interlocutors, they try their level best to be in the softest manner they can. There wouldn't be much problem, I suppose. I don't know much, but still. Okay, so the very first thing is don't be scared. Just be bold, like you handle an emergency case. And here there is 2 emergency cases, 3 minutes to prepare, 5 minutes emergency. That's it. Okay. I think I'll stop for now. And anybody? Okay. I didn't hear. I knew there was some response. I was talking. I couldn't hear. Okay. So I will stop here. And any questions you can ask me, and I'll definitely answer it for you.
Hello.
That's fine, right, Rajani? Yes. Saleen? Yes, you can tell.
Yeah, ma'am.
Good evening,
Saleen. Thank
yes.
you so much, ma'am, for your inspiring words. On behalf of the EduSkills family, I take this opportunity to thank you for your insightful presentation. And you have addressed the real issues which usually happens in the speaking session. It was really kind of you for taking this much time and effort in addressing the problems during the sessions. Thank you so much, ma'am.
Okay, thank you so much, Saleen. I'm happy to know somewhere it was actually helpful. Thank you so much. Thank you.
Ma'am, it was really helpful, ma'am. It was really helpful. The issue was for all the participants for the OET or who are the aspirants of the OET is the fear to face the exam. That's a real thing, and you have addressed the issue and you have properly told how to reduce that fear. That is the thing all the aspirants have to take to reduce that fear, to face the exam properly. Thank you so much for the inspiring words, ma'am.
There was one person actually who was, really scared. That was Lily Ball, who was another person who inspired me, after that, every candidate who comes to me, they get a 5 minutes talk from me. Definitely, I tell them 5 minutes emergency, 3 minutes preparation, and everything. I tell them. So I think Lily Mall is fine right now. I suppose she did it, so you all can do it definitely.
Hello.
Okay, thank you. Hello, Lily Mall.
Maria Chechi. I am here. Yes. I am hearing your words. So thank you so much. You explained it very beautifully how to approach while doing OET speaking. Initially, I was so scared to talk in front of anyone, but you teach the way of you teach me. It was so so good for me. I don't know how to express my words. I don't know.
No, I cannot tell you, Lilimal, I taught you actually. It so happened, there are sometimes people ask me doubts about OET, but to be very frank, never have I given anybody anything as such, okay? Just that I tell them, this one I tell them, because that was some insight I got during that time. Yeah, those time when I met Lilimal. So I tell them this is a 5 minutes emergency, 3 minutes you have to prepare. That's all. Then Lilimal was like, Chichi, can you just help me with the test? I was like taken aback. Oh, am I supposed to be giving a test? That was my question initially. Then I realized I had to do it. And I don't think I did much, because one thing about Lilimal is I knew she had enough for the test. Her language was enough for the test. I was very sure about it. And I was surprised what was happening for the test. It's only after I interacted with her, I realized what was the problem, and she knows that very well, and she cleared it. That was the next thing. And you won't believe, I don't think we did more than 3 or 4 exercises, but the same task we were keeping on repeating. One time we do that 5 minutes task we do. Then after that, I tell Limal, why don't you do it like this? no, why don't you do it that way? And soon she realized. And I, to be very frank, I didn't have much time. I'm sorry, Lily, but I didn't know she was with a broken leg and all. I didn't know all that. Okay, I came to know all that. But she was the one who constantly, Chichi, can you just help me with the speaking session? And that is how I came in for this. I have never given anybody a speaking session as such, because it never occurred to me, and I never really could sit for it also. But as you said, Lily was a Chichi, somehow can you spare some time for me? And God did allow that. Okay, that's the greatest part. And she's the one who gave me more awareness into this problems and etc. with OET. And yeah, thank you, Lily, for you're also a part of it.
Anyway, thank you, Maria Chechi. You beautifully explained it, and you given us such a wonderful explanation. 5 minutes emergency, 3 minutes preparation. So this is how the how inspirational words for the all the OET aspirants through these words. So everyone can approach the OET speaking. So nowadays, I am also starting to teach all the students whenever they are approaching me. I am also telling them. So this is the 5 minutes emergency, 3 minutes preparation. So you can do it because
I
all
think
of us,
us,
yes,
all
going through
of
this
us
emergency
should tell
situation.
our friends.
Yes,
Exactly. All
yeah.
of us should tell our friends so that nobody will come in scared. Be very
Yes,
bold.
this is
You
a
are bold now.
beautiful explanation actually.
Yeah.
Thank
Just
you.
thank
Thank you
God. He is
so
the
much
one who
on
gave that
behalf of,
insight. Thank you. Thank you,
thank
Lily.
you so much on behalf of all EduSkills family. Thank you.
Thank you so much. Thank you so much. You're welcome, my
Hello,
dear.
Maria.
Yes, Father.
Yeah, very glad you are in this family. We call this as
Thank
a
you, Father.
family. This is not a platform. Yeah,
Yes.
we have lovely friends here, thousands of them. It will be
Yes,
very great,
Father.
and we wish you get some
I
of
should
your.
thank you, Father, for this opportunity, actually.
Yeah, this is a great privilege for us to learners here, definitely. And if you can spare, sometimes I request you to join us even again, so that we can
Definitely.
strengthen so many those who are struggling. Maybe your words will
Definitely. If
motivate them. Yeah.
Anything
Malayalam.
it can be of help, I'll definitely be there, Father. No issues.
Father,
Yeah.
one session in Malayalam too. No?
Yeah, one session in Malayalam, Rajini is requesting.
No issue. There is no need for request, Father.
Okay,
She can just
okay.
tell me any
Really,
time.
really.
But then I
Yes,
also
yes.
felt the family feeling was there, Father. Thank you so much for that as well.
Yes, yeah. Definitely, this is a precious moment for all of us. And the room was full to the capacity. Many were in the waiting room. We could not help it. Yeah.
Yes, I couldn't enter, Father.
Yeah. No. I was removing some people to make you get in. Okay. Yes.
Okay, Father. Anyway, nice meeting you all. So anytime,
Yes.
from my part, any help I can always be. I'll be there.
Yes. Thank you so much.
Thank you, Father.
Yeah. And
Thank you so much.
yeah.
Thank
Anyone?
you.
Yeah.
Bye,
Thank you so
bye,
much.
everyone.
Bye.
Bye.
God bless you. God bless you.
Thank
God
you.
bless you,
Thank
Mika and Maria,
thank
for both of you. Thank you. God bless
Thank you, Father.
Yes.